difficulties. Okay, the next very important thing, as I had told you guys about the autism, that whenever you go for the viva or for interview or something, that you should know the professional language. The word should be on your fingertips, and these are this. Whenever someone asks you to define ADHD, it's a persistent pattern. You have to look at the word of the persistent pattern, because we have to also look at its duration of presenting complaints. Okay, so a persistent pattern of inattention or hyperactivity, impulsivity that interferes with functioning. Okay, so you have to look at the DSM-5 TR criteria. I have sent you guys the criteria, the DSM-5 TR, so you have to look at the book every time whenever I discuss a case or disorder with you. You have to cross check it through the DSM-5 TR and learn it in more professional language. Okay, the next is DSM-5 TR. The symptoms persist for at least 6 months. The duration matters, and the age also matters. Several symptoms present before age 12. So you have to look at this age, and also the number of settings matters. Okay, so you have to look at these three things very carefully. The symptoms persistence, that what was the long months duration, and then you have to look at the certain age, that when did the symptoms started to appear. Okay, and then you have to look at how much settings it's affecting, like it's in home, it's in schools, it's in community, each and everything. You have to look at the different settings. Okay, you have to very careful about the presentation. It's predominantly inattentive, because on the presenting complaints you have to decide that what the child is. Either he is inattentive, either he or she is hyperactive, or maybe some children are like presented with a combined presentation. So you have to also go for the severity level, either the child is having a mild, moderate, or severe, because according to the severity level we have to go for the intervention. Okay, this one very careful. I will take the test of you guys through this, that it should be on your fingertips about the inattention and hyperactive impulsivity. There are further 6 points in inattention and further 6 points in hyperactivity or impulsivity. Okay, what does the inattention means, and how can we define the child is inattentive? Okay, so he or she will present these complaints: difficulty sustaining focus. He or she can't focus, they are having the focus problem, they doesn't seem to listen. Okay, lose material, because they are not providing the attention, they are not giving the focus, they don't care bundles of things, so they lose their material, they're like on possessions. So they have the poor organizations, avoid tasks requiring mental effort, so their brain is always on the rush, so they don't focus a lot. So the thing in which mental effort and consistency is required, they like lack on it. And forgetful in daily routines. As I've told, their attention span is not too much, so they forget, like the attention is getting diverted again and again on repetitive. The attention is diverted. When the attention is diverted, how can they like focus on one thing? And when they don't focus on something, of course the thing is not going from sensory memory to short-term memory and then the long-term memory, so they will of course forget things. Then there are hyperactivity or impulsivity, fidgets or leaf seeds. I have told you about the fidgets. Like, what is the fidgeting or leaf seed? Like, they have the very they move in a rush without having any directionless movement. And the leaf seed runs or climbs excessively, difficulty playing quietly, talks excessively, blood source answer. They don't know whether the teacher is asking me or somebody else. They just get the question and answer it. Okay, so difficulty waiting turn. Of course, the waiting is quite, in severe cases, waiting is 0. So we have to, being a behavior therapist, work on their waiting. And remember that in autism, in ADHD, we have to work a lot on the waiting of these children. Okay, this is a case, and you have to look at this, that these are the presenting complaints of Rayan, 6 years. Okay, these are the things, and you have to make assignment on this. Okay, this will be your assignment, that what are the ADHD, what are the ASD, and how could both be present. You have to look at this. Okay, let's go for the IDD and the global developmental delay. Okay, for the IDD, there are two major things you have to look at it. Like for example, if I'm coming, that what is the diagnostic criteria of intellectual developmental disorder or ID का student जो है, ID का जो बच्चा है, like what does he or she have, that you are defining or you are diagnosing that he is ID child. So the thing is, there are two major domains, intellectual functioning and the adaptive functioning. So you should know what does the intellectual functioning means and what does the adaptive functioning means. Okay, so the thing is, in Pakistan we don't use too much professional language in our daily routines. Okay, we just use very layman language, and the main thing is there is bilingual or there are trilingual. We just use bundles of language, like there is a Punjabi, there is Urdu, there is English, so bundles of things. So the thing is it affects. Okay, so but let's go into the intellectual functioning. How can we say somebody is intellectual functioning, like he is highly intellectual? The thing is, you have to look at the intellectual or executive functioning. What does the executive mean? Okay, you have to look what does the executive mean. What does the frontal lobe, prefrontal lobe, what does it do? Okay, so let's go for the intellectual functioning and the adaptive functioning. Intellectual functioning, it's a reasoning, problem solving, planning, abstract thinking, academic learning, learning from experience. So you have to look the reason. Okay, can a child like give a logical explanation for something? Can they do the reason of something? Okay, can they resolve the problem? Like what does the skill they have about problem solving? How they plan the things? What is their abstract thinking, like imagination in each and everything? Academic learning, learning from experience. Okay, then is the adaptive functioning. Adaptive is about daily routines. Okay, so adaptation. When you will learn about the Vineland, you will know it's an adaptive scale to measure adaptive functioning. So we will look at it, and the first thing is adaptive functioning, the daily independence. Either he or she is totally independent for his or her daily routines, like change your own dress, go to your washroom, eat your food. These are the things that daily independence. Communication, either he or she has a social communication or not, whether they have the like gestural communication, to and fro communication, verbal, non-verbal, each and everything. The social participation, the practical life skills, the safety awareness. Okay, safety awareness, you have to look very carefully. I will teach you guys that we have read multiple times there are five senses, but when you get into the field of behavior therapy, okay, you get to know there are 8 senses. Okay, so one question is more, that is, what are the 8 senses? You have to note down this and like list down the 8 senses. Okay, so list down the 8 senses and what does each sense means. You have to give me the answer of this. And then the developmental onset, of course, is a neurodevelopmental disorder. It will start at the developmental period. Severity matters a lot. Okay, and then the assessment and clinical judgment. Of course, you can't diagnose somebody as ID until you have done the standardized assessment. And for the assessment, there are multiple tools. As the PG was first, we were used to PG, and then we are moving towards the VAF, and there are multiple tools coming. Clinical judgment, it means interview and your clinical observation. These things let you know, and it happens with the experience. Okay. 3 adaptive domains. Okay, as I told you guys about the adaptive, there was intellectual functioning and then there is the adaptive functioning. The major thing is on adaptive functioning. Just fingertip what is adaptive functioning. Okay, the 3 things come in adaptive functioning: conceptual domain, social domain, practical domain. What is conceptual domain? Language comprehension, reading, writing, maths, basics, memory, problem solving, understanding time, money. These are the concepts. What are we used to say in our childhood, like for the paper or whatever? Concepts should be cleared. Okay, so the thing is, what is the conceptual like domain? How are they conceptually intelligent? So, sorry, these things matter a lot. And then there is a word written, you can look at this. Adaptive skills explain day-to-day supports needs. Okay, day-to-day words matters a lot. Okay, you have to can you just imagine somebody who can't have any memory, who cannot resolve any problem, who doesn't understand the time, the day, night, evening, he or she doesn't understand anything. So do you think his or her day-to-day life will be okay? Not at all. So let's go for the social. We are the social animals, so we have to work in the social domain too. Okay, what is the social judgment? What does the social judgment mean? If, for example, somebody is passing the sarcasm and someone is laughing at you, or someone is like through the gesture not inviting you to some party, are you getting it or not? So that's the social judgment. You should know it, that what is the point? Either I have to laugh at here, not laugh at here. What are the social requirements at that time? And then there is the friendship skills, empathy, communication with others, risk of being misled. Okay, then is the practical domain, self-care. I have told you guys about the practicality, the self-care, eating, dressing, hygiene. And the thing is, when the child comes to us, we have to work on this. As I have told you multiple times, that behavior therapists are the lead therapists, we are the umbrella terms. So we have to cover each and everything, and as you know, we are covering the 25 domains of life. You have to work on the eating, dressing and hygiene. Then you have to follow the routines. What are the routines? Early morning, evening, afternoon, each and everything. But the concept of safety, either they are running on the roads, they know the safety of like getting burned or not. Home and school responsibilities, because sometimes when you get into the normal schools, there are multiple cases of inattention. Okay, multiple times the child doesn't come home with a proper homework task or something. Sometimes they have lost their diary, their geometry, their each and everything. And what does in Pakistan the solution? It's just like beat, the slap. क्यों नहीं किया? You should have done it. How did you forget it? You are not responsible enough. Stop, please. They don't know, their brain is not working. That's not their mistake here. Okay, so the thing is, example, a child may recognize letters. For example, if you're behavior therapist, you work on his or her academic task, but still need help toileting. Toilet training is a most important task, guys. Most important. Following two-step instructions and staying safe in the clinic. And let's go for the global developmental delay, and that's very, very, very important. And there are not too much cases, but there are some cases of global developmental delay. So you have to look at the difference between the global developmental delay, the ID, the ADHD, the autism. You have to look at each and everything. First, it will confuse you a little bit, but you have to look at the videos, so you will get the idea. Okay, global developmental. What does the global mean? The global covers all things. Okay, it means the developmental delay was in all domains of life. Like he had delay in motor, he had delay in language, he had delay in social, he had delay in cognition, he had delay in adaptive, he had delay in hearing, visual, medical history. Everything was delayed. Okay, maybe the child is just starting to walk at the age of 4.5. At the normal, it's starts from the 9 months to 1 year. Okay, so the thing is, you have to look, whenever somebody comes to you, you have to look at the history. You have to ask these questions. Okay, for whenever somebody comes to you, you have to, while taking the history, you have to ask these questions about birth history. And the very important thing, either the child cried instantaneously or not. Okay, when the child cries at the peak moment, when he or she get birth, it's very good. When there is a delay of 5 seconds, 1 second, even the 3 seconds, the 30 seconds, even 1 minute, The thing is get the idea that there is going to be some disorder in that child. Okay, screen time matters a lot, so you have to also look at this. Okay, this is the thing, and I have written your task. Intern task is written here. Okay, so you have to look at this. There are the presenting complaints, this is the case study, and you have to look here. Let's go for the communication disorder. Hurry up. The communication disorder and the language disorder. Okay, so there are multiple. You have to look at this. The thing is communication and the language. First of all is the language. Either the language is developed or not. When language comes, the sound is okay, then we go for the communication. First of all is language. Does the child has the language or not? Okay, then we go for the communication. But let's go and deep dive into the communication disorders, and case examples will be further here. Okay, the thing is you have to look at the language, speech, sound, fluency, and social communication. Okay, let's go for this one. Very easy. The language disorder. In language, there are three major terms: form, content, and use of language. Okay, and then, for example, short sentences, vocabulary, understanding directions. It's a speech sound disorder. Like, does the child have an issue related to speech, like speech production? There is an issue in production. There in fluency, there is issue in flow and timing of speech. In social communication, like verbal and non-verbal, social, there's like in social interaction, the word comes here, social interaction. Okay, these are the examples. You can look at this, but the thing is that you have to look here very deep. What are the language does mean? There are three terms: form, content, and use. For speech, sound, there is like production issue. For the fluency, there is timing and flow. For example, the stuttering, mama, ma. The thing is, that's a fluency. Okay, they like this stutter. And the thing is repetition, prolongations, blocks, tensions, fillers, that comes with a fluency. And let's go for the language disorder and ADHD. Language disorder, more likely when a child shows social interaction. It means the child has the social interest, use gestures, joint attention, plays flexible. We are just learning the difference between these two, because bundles of times we have to deal with the children with the language developmental delay. They come with us, and we cannot diagnose everybody as ASD, because the social interaction and the language disorder, both are different things. Okay, so you have to look, either the child is having social interest, good job. Okay, he or she has a joint attention, very good job. Like, they have the imagination, good imagination, imaginative play, abstract thinking, so very good job. Okay, so these things. The major problem comes here: vocabulary, grammar, and comprehension. Okay, then is the social communication disorder. Social, we can also call it pragmatic, because we have to work on the sentence formation for this communication. Social communication difficulty without restricted repetitive behavior patterns. Like, there is a social issue. For the ADHD, there was restricted and repetitive patterns of behavior and deficits in social interaction, social communication. So the thing is, they have the social communication issue, but they don't have the restricted repetitive patterns of behavior. So this is the difficulty using communication for social purposes. Trouble changing communication for listeners, so they don't get the point. And the next is literal interruption or inference difficulty. They don't get your point, they don't infer the information directly, like hurry up, or if you say okay, wind up, clean up, hurry up, let's go, they don't get it instantaneously. So they take time to infer the information you are providing or any sentence you are speaking. So the next is important difference. ASD requires restricted repetitive behaviors. If RRBs are present, consider ASD. RRBs means restricted repetitive behavior patterns. And then you have to look at the history, clinical support, like how can we work on it, social stories, conversation mapping, role play, peer mediated, parent coaching. We will learn these things with passage of time. Okay, for example, a child speaks fluently but does not understand turn taking, topic shifting, adaptive language with younger children. And let's go, the most important thing is learning motor and tic disorder. So for learning there's academic, of course. For learning we have to look at the academic domain of life, and then is the motor and tic disorders. Specific learning disorder, let's go for the specific learning disorder. Specific, in the name the word is specific written. Okay, so specific learning disorder, like, let me tell you one thing. When you were a child, you were used to love, somebody was used to love math, somebody was used to love English, somebody was used to love science, somebody was used to love Urdu or maybe geography or something like that. Okay, some were used to prefer give test orally, and some were used to love to give written test. Okay, so the thing is ki, that's all about your specific learning. You have the interest in specific areas. Okay, so let's go for this. Persistent difficulty learning using academic skills below age expectations or cause impairment, begin during school age years but may appear later when demands rise, not better explained by IDD, vision, hearing, lack of instruction. And very important thing is that whenever something comes to you, you have to look at the physiological or medical test, that are they okay with every that thing. Okay, and then let's go for this reading, writing and mathematics. There is a certain psychological proper professional word. You have to look at that. What does the deficiency or impairment in reading define? I can give you, for example, the hint, that is, for example, dyslexia, and these two others are called as what? So you have to write in that assignment reading, writing and mathematics. Okay, and in mathematics there are also multiple things. Some are good at calculation, some are good at reasoning. Okay, for example, if you remember in your childhood, there were bundles of times it was like the train reaches at 5 minutes, and then at the like the 10 minutes, and you have to calculate each and everything. I don't remember each and everything now, but the child is of this year and the father is of this year and the sister was that of years. That is a reasoning. Okay, there are sometimes algorithm, each and everything, algebra. So everybody has different kind of interest, and somebody have different impairments too. Okay, let's go for this one. Developmental coordination disorder, stereotypic movement disorder. Developmental coordination, motor skills below age expectations, interface with self-care, play, writing, sports, daily tasks, not explained by neurological condition or visual impairments. And stereotypic movement disorder, okay, repetitive driven apparentless purposeless movement. For example, there is a typical movement, we walk, like we run, there's a proper like typical movement things, how we walk, how we run, each and everything, how we jump. But for the stereotypic movement disorder, when the word comes the disorder, it means the red flags have overcome. And now we have to look at this hand waving, body rocking, head banging, and there are certain causes or impairments or risk of injury. So you have to look at, and a very important thing, we work with, of course, is integrated approach to deal with the special needs children. We have to look at the OT therapist, like occupational therapist, physiotherapist, speech therapist. Okay, so you have to look at everything, and the neurological testing is very important when the word comes with the motor movement. So sensory and motor profile is very important. Tic disorder and Tourette disorder, I had just like seen very few cases for this. So let's go for this tic disorder and Tourette presentation. For the tic disorder, what are the tics? What are the tics? If you guys know, then you can let me know. in the like your assignment. If you guys don't know, look at the video. Okay, and one very important thing I will tell you guys, that whenever you learn something, whenever you like learning something new, you should try your best to look at his or her video. Okay, so the thing is, tic disorder, tics are not intentional misbehaviors. They often fluctuate with stress, fatigue, or attention. For example, sometimes you have seen when you are like very stressed, because the stress is a psychological disorder. Okay, so the thing is, when the psychological things get over, we don't like get them treated, and especially in Pakistan we just underrate every psychological matter or disorder until or unless the person who is having has negatively affected each and everybody around his or her. Okay, so we take it's okay, it will be okay, you just offer prayer, you just like do this, go for the morning walk, you will be okay. No, sometimes a lot of counseling is required, but in Pakistan, sorry to say, there are very worst conditions. Some things are getting better, but still there is a lot of area need to be improved. Okay, so let's get back to this, that the psychological things get converted into the physiological, and for the physio, okay, it affects your muscles, it affects your stomach, it affects your gut health. The psychology impact very badly the physiology. Okay, so if you remember, when we were used to get to the doctors multiple times, first thing they ask, आपको कोई टेंशन तो नहीं है? Do you have any kind of tension? Are you getting stressed over something? Because they know that stress is the major thing of like everything. It's a powerhouse for every disorder. So the thing is that we fluctuate, we like sometimes you will feel that your fingers are moving, flapping, so it affects a lot. Okay, if somebody is suffering from this, please take good care of yourself. And the Tourette disorder, let's move towards the Tourette disorder. Multiple motor tics and at least one vocal tic occur at the same time. Sorry. Multiple motor tics symptoms persist for more than 1 year. Okay, as I was telling you, because of stress we feel the shivering in our hands or something like that. Okay, it doesn't, if it is happening for more than 1 year or something, we have to go to the doctor. But if it happens because of like over stress, you get to know like my body is getting negatively affected. Symptoms persist for more than 1 year. Onset before age 18, not due to substance or other medical condition. Okay, the clinical handling, the same thing is don't punish, ask about stress, fatigue, sleep and anxiety. You have to check at the overlap and refer to the psychiatrist specialist when needed, because these, first of all, these disorders have to be get treated by the psychiatrist, and when they refer to us, we have to move towards the like multiple things for their treatment. Okay, let's get into the difference. So you have to look at it very carefully. It's your task, you will read this. So these are all your things. Okay, very important things, how do we assess? Okay, how do we assess? Just don't look at the child and oh, he's autistic, oh, he's ADHD, I think he is suffering from the ID. No, please, there's a proper pattern, there's a proper workflow for these things. So the referral concerns, first you have to always look at the presenting complaints and then go for the consent. For the parents, that we are going to like assess the child, are you like willing for it, and then you have to ask for the developmental history, and I will send you guys that what do we have to ask the parents for the history. And then is the direct observation, rating scales and tests. That's very important. Please, if you are a student of BS, until unless you have done the masters, don't get into it. Okay, you should have some international certifications or the masters. Before than this, please, you are risking your own career and like also affecting the parents. And then you have to go for the differential formulation, the feedback, the report writing. Of course, it matters a lot. And very important thing about the report writing is it should be according to the international standards. I have seen the reports of multiple institutes here, and honestly, when I look at it and I'm like, oh my goodness, just like please work on it, work on your report writing. And you guys are my intern, I will just tell you, can look at the international standard. The main thing is the guy, somebody, the team who had developed the test, I don't think so somebody else than that team or than that guy can tell you how to write a report. So you have to look at that format, that how to write a report. Okay, so don't make your own report writing criteria or own report writing formats, each and everything. Your report writing for that specific test should be according to their international standards. And then you have to write the of course IP plan, the support plan. Okay, and this is the things you have to ask. As I told you about the developmental history, you have to ask about the parents. Okay, it's early developmental history, pregnancy and birth history, milestones, and then there's a communication history, there's a social history, there's a daily life history, there's a medical and sensory history, there is a context history. Okay, so you have to read this down. And for the observation, these are the things which you have to look while observing a child. Okay, so for the communication, you have to look either the child is responding, having response to him or not, either he or she can request or not, what is his or her gesture language, what is about the joint attention, what is about the conversation quality. Then you have to look at the behavior and regulation, what is their behavior, how are they transitioning, like from one activity to another activity, from one room to another room, how are they moving, what's their transition, do they have, like, are they capable enough to wait, what are their sensory responses, how do they get triggered on tantrums or traumas, each and everything, their attention span. Then the learning, and learning is very, imitation is very, very important. Imitation, gross motor imitation, vocal imitation, verbal imitation, imitation matters a lot. And the same thing goes, you can read this, the same is adaptive. I have already talked about the adaptive domain. Okay, so this is the thing, and it's very important. And you have to look, either you know these tools or not, and in your assignment you will let me know that what are the tools you have to learn more right now. Okay, what are the tools you know and what are the tools you don't know, and you have to learn on fingertips that what are the like assessment tools for the autism, what are the assessment tools for adaptive functioning, what are the assessment tools for cognitive measurement, the behavior and attention, the language and speech, and the motor sensing. And of course I can teach you guys these two, and this, yes, this, and this is not my domain. As I told you, it's integrated approach. We have to look for the like speech therapist or OT therapist for these things, and I will prefer just stay in your domain. Okay, there is no need to be non-speaking to go into another field. You can go just to learn something. Don't take their role. They have done their degree, let them do their task. Okay, and then there is a case formulation. You have to look here, and there are cases. You can look at these cases. The same thing. Ethics, of course, ethics matters a lot. You have to answer me these questions, okay? These are the references, and finally we are going to reach at the end of this, the professional takeaways. And at the end of this week, you should know these disorders. I know sometimes maybe because many students are busy with their vivas and each and everything, but the thing is we have to work on our internship too. Okay, so please learn all of these disorders. and you should have make proper notes. You should have proper notebook and note down each and everything there. Okay. Okay, bye bye everybody. You can ask me any question in the internship discussion chat box, and see you soon there. You can listen it and let's go for it. Allah Hafiz everybody.